So now let's move on to our next topic, which is the multiple pregnancy. So multiple gestation or multiple pregnancy is considered a complication of pregnancy because a woman's body must adjust to the effects of more than one fetus, and then multiple gestation puts an additional strain on a woman's physical resources and may lead to preterm birth with immaturity of her infant. And the next, the picture shows about the multiple gestation. So there are two types of multiple gestation, which is the first one in letter A, the dizygotic twins showing two placentas, two chorions, and two amnions. And then in the section B, which is called monozygotic twins, which has one placenta and one chorion and two amnions. So now, unsa din ang monozygotic? Ang monozygotic are also called as identical twin. It begin with a single ovum and a spermatozoon. In the process of fusion or in one of the first cell division, the zygote divides into two identical individual. The single ovum twin usually have one placenta, one chorion, two amnions, and two umbilical cords. The twin are always have the same sex. So next is ang dizygotic or the non-identical twin. It is the result of two fertilization of two separate ova by two separate spermatozoa, possibly not from the same sexual partner. Double ova twins have two placentas, two chorions, two amnions, and two umbilical cords. The twins may be of the same or different sex. So sa kani nga duha nga mga multiple gestation, ang monozygotic twins has the greatest risk because ang fetus is nag-share sila og vascular communication. So it is possibly leading to overgrowth of one fetus and the undergrowth of the second. So di ba kay ang monozygotic has a single amnion naman siya. So if single amnion is present, there can be knotting and twisting of umbilical cords, causing for fetal distress or difficulty with birth. So because of this complication, ang woman with pregnant with twins must needs closer prenatal supervision than a woman with single gestation para ma-detect ang problem as early as possible. And then, generally, um, a woman carrying more than two fetuses is at greatest risk. So, next is the nursing diagnosis and related intervention. So, nursing diagnosis, fatigue related to increased stress on body functioning secondary to multiple gestation. Outcome evaluation. Client state that she is tired but identifies steps she can take to minimize fatigue. A woman is carrying a double weight during pregnancy, makanotice siya og extreme nga fatigue and backache late in each day. She may have difficulty resting or sleeping than the average woman because of this greater discomfort and increased fetal activity. So, sa magtikadako ang iyang uterus, ang iya pong stomach, magtika-compress pod. So, maglisod na siya og katulog. So, and then, ang iyang appetite is magtika-decrease. To maintain the nutrition of the woman, a mother may need to eat 6 small meals a day rather than 3 large ones. And then, she must be sure to take her iron, folic acid, and then the vitamin supplements. Next nursing diagnosis is fear concerning her own and the baby's health related to risk of multiple pregnancy. In the outcome evaluation is the client accurately state risk of multiple pregnancy, expresses confidence in health care teams' ability to care for her and her babies through pregnancy and birth. With multiple pregnancy has more reason to fear for her life and the life of her babies than does the average woman. So, ang kita naman guro tanan guro batit naman guro sa story about sa mga twins nga ipanganak sila og mga premature og ang uban kani is dili makasurvive og ang uban pod um, mabatian nato kung unsa gud ka delikado ang pagpanganak og twins. So, if wala pa gani siya, if ang usa ka mother is wala pa nakabatian na nga story, dapat maingnan na siya usa ang iyahang due date sa iyahang pagpanganak. So, ato ipaintindi sa iyaha nga kadto nga mga stories dili lang to buwa-buwa. So, kay tinuod jud nga ang prematurity and high risk to the last born infant are real hazard in basta't naa ka sa multiple gestation. So, ang dapat nga buhaton is help a woman deal with her fears as positively as possible. It is helpful to tell her it is no indication so far that her babies are in danger. So right now, it is best to continue doing the things that have to be done. If any problem should arise, the healthcare team and a woman's family will be there to support her. So next is the hydram news. So unsa day ng mga hydram news? It is the overproduction of amniotic fluid above 2,000 ml, a condition that can lead to ruptured membranes and premature birth because of increased intrauterine pressure. So, ang amniotic fluid volume during pregnancy is usually 500 to 1,000 ml at term. So, if mulapas na gani siya og 1,000 ml, above 2,000 na, it is called hydramnios. Next is the causes of hydramnios. So, here are the causes of hydramnios. First is the digestive problems that block fluids. Next is the twin-to-twin transfusion syndrome, which is a condition where identical twins share a placenta. And next is the problems with swallowing that may be due to a central chromosome issues. And then heart failure. And the last one is infection. Next, the picture shows a polyhydramnios, which an excessive amniotic fluid surrounding the fetus. Next is the symptoms of hydramnios. These symptoms can occur a bit differently in each pregnancy. This includes the fast growth of uterus, stomach discomfort, uterus that is larger than normal for how far along you are in pregnancy, labor pains, or contractions. Next is the oligohydramnios. So what is oligohydramnios? Oligohydramnios is the lessened amount of fluid and suggests a renal disorder exists in the fetus. Condition may happen for several reasons. It may be due to not making enough fluid, or it may be caused by problems that lower the amount of fluid. So here are the causes of oligohydramnios. First is the water is breaking before you go into labor. Second, poor fetal growth. And then third, your pregnancy going past your due date. Fourth, birth there is a birth defects in kidney and urinary tract problems may be likely. And fifth, and lastly, you are pregnant with identical twins who shares a placenta, which is called twin-to-twin transfusion syndrome. Next is the symptoms of oligohydramnios. First is leaking amniotic fluid, which may caused by the sac breaking. Next is not enough amniotic fluid seen in ultrasound. And lastly, uterus is smaller than expected for how far along you are in pregnancy. As you can see in the picture, it looks like an angry baby. So it is a baby with oligohydramnios complication. The goal treatment of oligohydramnios is to keep you pregnant for as long as it is safe. So the treatment will depend on your symptoms, pregnancy, and general health. It will also depend on how severe the condition is. Treatment may include monitoring, regular checkups, and then delivering the baby if the problem is too risky for you and your baby. You may have to deliver it early. Next is the post-term pregnancy. Post-term pregnancy is pregnancy that extends beyond 42 weeks as the placenta deteriorates at this time. it can cause a fetus to receive decreased nutrients. Next is these are the certain risks associated with postpartum pregnancy. The chance of stillbirth or infant death increases slightly. The most postpartum term fetus continue to grow and large size can cause problems during pregnancy. And frequently, the fetus may not continue to grow and may become malnourished. Beyond term, the fetus is more likely to have a bowel movement called meconium into the amniotic fluid. Next is the prevention and treatment of postpartum pregnancy. First is the antenatal fetal monitoring, non-stress testing, biophysical profile, and inducing labor, which is the optimal time to deliver a baby in a pregnancy that is postpartum, is sometimes hard to determine. And the next complication is pseudocyesis or false pregnancy. Nausea and vomiting, amenorrhea, and enlargement of the abdomen occur in either an unpregnant woman or a man. Causes of false pregnancy is psychological and physical issues. Psychological factors may trick the body into thinking that it's pregnant. Next is the symptoms of false pregnancy. Women with pseudocyesis have many of the same symptoms as those who are actually pregnant, including interruption of the menstrual period, swollen belly, enlarged and tender breast, feeling of fetal movements, nausea and vomiting, weight gain, and sometimes labor pains. In treating false pregnancy, the doctors must provide psychological support, including therapy, to help the patient with pseudocyesis recover from their disappointment. The next complication is the isoimmunization or Rh incompatibility, which a woman and her unborn baby carry different rhesus or Rh protein factors, and it occurs when an Rh negative mother carries a fetus with an Rh positive blood type, and this condition is preventable. In this condition, your baby may have one or more of the following symptoms if their bilirubin levels are high after birth. So these are the symptoms that may develop in the baby. First is the jaundice, which is a yellowing of the skin and whites of the eyes. Next is the lethargy and the low muscle tone. So next, how is Rh incompatibility treated? Treatment focuses on preventing the effects of the incompatibility. In mild cases, the baby can be treated after birth with a series of blood transfusion, hydrating fluids, electrolyte, which are elements that regulates metabolism, and phototherapy. So, phototherapy involves keeping your baby near fluorescent lights to help reduce the bilirubin in their blood. And this procedure is repeated until the excess bilirubin of the baby's blood is removed. Next is the complication. Severe cases in which the effects of Rh incompatibility are prevented can result in severe complications. So this complication may include brain damage to the baby, which is known as kernicterus, fluid builds up or swelling in the baby, trouble with mental function, movement, hearing and speech, seizures, anemia, and heart failure. This condition is preventable. If you think you may be pregnant and you have an Rh negative blood type, you should talk with your doctor to determine the best plan for you. And the last complication is the fetal death. It refers to the spontaneous intrauterine death of a fetus at any time during pregnancy. Fetal death later in pregnancy at 20 weeks of gestation or more, 28 weeks or more, for example, are also sometimes referred to as stillbirth. So there are three classifications of stillbirth. First is the early stillbirth, which is the fetus dies between 20 and 27 weeks. Next is the late stillbirth. The fetus dies between 28 and 36 weeks. And the last is the term stillbirth. The fetus dies the 37th week or after. So next is the causes of fetal death. So the causes of fetal death is vital not only for the health providers to know, but for the parents also to help with the grieving process. And these are the common causes of fetal death: problems with the placenta or umbilical cord, high blood pressure or preeclampsia, clotting disorder, infections, birth defects, and poor lifestyle choices. Next is the physical symptoms that the mother have after stillbirth. The mother may have fever, bleeding, chills, and pain. And lastly is the management and treatment. So this treatment is applied if your baby has passed away before you are in labor. So these are the three options. First is the induced labor, second is the natural birth, and the third is the cesarean section. That's all. Thank you for listening.